Hey guys, Dr. Andrew here from Chiro Wellness Centre. Welcome to this episode of the Chiro Couch. Now today we're talking about the shoulder. You see, the shoulder joint is something you actually don't realise how important it is until you actually injure it. Recently my son dislocated his shoulder and I can tell you that's an extremely painful injury. And there's a lot of rehab to get you back to your former glory afterwards. But we're not talking about dislocations today. We're going to talk about a specific type of injury causing the shoulder, and it's known as frozen shoulder. So what is frozen shoulder, by the way? Well, frozen shoulder is adhesive capsulitis. It's where your shoulder has significant pain and extreme stiffness where you can hardly use it. The signs and symptoms are typically associated with where they're slow starting and they'll worsen over time. And there are 3 stages which develop, but I'll break that down later in the video. But let's talk about why someone might experience a frozen shoulder. You see, it's often caused by inflammation of the capsule of the surrounding tissue of the shoulder joint, resulting in gradual loss of movement of the glenohumeral joint. And it's known that because it's the most mobile joint, it's important to have ability to move that particular joint. Now, this may be times after injuries where you're required to immobilize your shoulder, or you might have a risk of developing frozen shoulder after something like surgery, a broken arm, or even if you're recovering from a stroke. And by the way, the most common people get frozen shoulder are over 40 years of age. Now, there are a range of exercises that will improve and test and improve the symptoms of frozen shoulder. And things like numbing lotions, injections can be helped as well. But the most important thing is that you keep your shoulder moving to prevent it from becoming frozen in the first place. Now, if you think you have a frozen shoulder, you might need an examination or an x-ray to determine what type of treatments you need to have. And it'll happen in 3 stages. The first phase is the freezing stage where the movement starts to change, and then the stage, that'll last about 2 to 9 months. The frozen stage is when you get increased amount of pain, and that goes for around about 4 to 12 months. Now the thawing stage is the final stage where the pain is gone, but you still have tightness for around about 5 to 24 months. As your body heals, it takes a very long time to recover from this injury, so it's obviously best to do gentle exercises in the early stages to prevent that shoulder from actually freezing up. Now, we've got a great range of exercises and treatment protocols here at our chiropractic office to help you prevent the shoulder injury from getting worse. But the most common things that we forget about when dealing with frozen shoulder is the flexibility of the thoracic spine and the neck, because stiffness in areas can affect your shoulder's function and nerve supply. And we know chiropractors are great at improving those areas as well. But if you have any questions in regards to frozen shoulder or whether you're a candidate for chiropractic care, please send us a message here or call us 5562 1311 and we'll assess whether we can help. So my name's Dr. Andrew from Chiropractic Wellness Centre, and I'll see you all next week on the Chiro Couch. Bye for now.